Hello, everyone, and welcome back to our health and wellness channel. If you're one of the millions of people worldwide taking amlodipine to manage high blood pressure or heart conditions, you're in the right place. Today, we're diving into a topic that could truly be a game changer for your health journey. Amlodipine is a powerful medication, but like any tool, it needs to be used correctly to work effectively and safely. In this video, we're going to explore 12 critical things you absolutely must avoid while taking amlodipine to ensure you're getting the most out of your treatment while keeping yourself safe. We're talking about everything from sneaky dietary interactions to lifestyle choices and medication combinations that could sabotage your health if you're not careful. Some of these might surprise you, and others could be downright dangerous if ignored. Our mission is to empower you with knowledge so you can take control of your health and make informed decisions. So, grab a notebook, stick around, and let's get started with these life-changing precautions. Disclaimer: this video is for educational purposes only and is not a substitute for medical advice. Always consult your healthcare provider for any concerns or emergencies. All information presented here has been thoroughly researched, and you can find source links in the description below. 1. Avoid taking unapproved prescription medications. First and foremost, never take other prescription medications without your doctor's approval while on amlodipine. This drug interacts with a staggering 545 known medications, ranging from major to minor interactions, due to its metabolism through the cytochrome P453A4 enzyme system. When multiple drugs compete for this pathway, it can lead to dangerously high or ineffective levels of amlodipine in your body. For example, combining amlodipine with other blood pressure medications like ACE inhibitors, for example, ramipril or lisinopril, ARBs, for example, valsartan, or other calcium channel blockers, for example, diltiazem, can cause additive hypotensive effects, leading to dangerously low blood pressure. For diabetic patients on aliskiren, combining it with amlodipine and benazepril is typically avoided due to excessive blood pressure reduction. Antibiotics like clarithromycin and erythromycin act as CYP3A4 inhibitors, potentially tripling amlodipine levels, while rifampin can reduce its effectiveness by up to 50%. Antifungals like itraconazole and ketoconazole, as well as HIV medications, hepatitis C antivirals, and antiepileptics like carbamazepine or phenytoin, also alter amlodipine's metabolism. Beta blockers, NSAIDs, and erectile dysfunction drugs each have unique interaction risks. The takeaway? Always check with your doctor or pharmacist before starting any new medication to avoid these potentially life-threatening interactions. 2. Steer clear of grapefruit and grapefruit juice. Next up, avoid grapefruit and large amounts of grapefruit juice at all costs. Grapefruit contains compounds called furanocoumarins, specifically bergamottin and dihydroxybergamottin, that irreversibly inhibit CYP3A4 enzymes in your intestinal wall. This can increase amlodipine's bioavailability by 15 to 25%, amplifying its blood pressure lowering effects and increasing the risk of side effects like dizziness or flushing. The effect is dose dependent, meaning the more grapefruit you consume, the stronger the interaction. What's more, this inhibition lasts 24 to 72 hours because your body needs time to produce new CYP3A4 enzymes. Even occasional grapefruit consumption can have prolonged effects. Pink and red grapefruits have higher furanocoumarin levels than white varieties, and fresh grapefruit juice is particularly potent. Processed grapefruit products may have less impact, but caution is still warranted. If you notice increased dizziness, headaches, or flushing after consuming grapefruit, eliminate it from your diet entirely and consult your doctor. Genetic differences in CYP3A4 activity mean some people may be more sensitive to this interaction, so don't take the risk. 3. Avoid St. John's wort and untested herbal remedies. Herbal supplements might seem harmless, but they can wreak havoc when combined with amlodipine. St. John's wort, Hypericum perforatum, is a major culprit, as it's a potent inducer of CYP3A4 enzymes. This can reduce amlodipine blood levels by 25 to 50% within 2 weeks, leading to inadequate blood pressure control. The effect lingers for up to 2 weeks after stopping St. John's wort due to its active compound, hyperforin, which boosts enzyme production via the pregnane X receptor. Other herbal remedies like ginkgo biloba, garlic extract, and hawthorn may also affect your heart or interact with amlodipine, but their safety is uncertain due to limited testing. Unlike prescription drugs, herbal supplements aren't subject to rigorous FDA scrutiny, so their interactions may go unnoticed until problems arise. Product quality varies widely, adding to the risk. To stay safe, avoid St. John's wort and discuss any herbal supplements with your doctor before use. Your health is too important to gamble with untested remedies. 4. Limit alcohol consumption. Let's talk about alcohol. Both alcohol and amlodipine are vasodilators, meaning they relax blood vessels, which can lead to additive hypotensive effects. Alcohol also has negative inotropic effects, reducing the heart's ability to pump effectively. When combined with amlodipine's calcium channel blocking action, this can cause significant blood pressure drops, especially in the first few hours after drinking when alcohol levels peak. This interaction is most pronounced if you take amlodipine in the evening, as it coincides with peak drug levels. While moderate alcohol use isn't strictly forbidden, it can intensify side effects like dizziness, fainting, fatigue, or headaches, particularly when starting or adjusting your dose. If you experience these symptoms, stop drinking and consult your doctor immediately. The key is moderation and monitoring. Pay attention to how your body responds, and always seek medical advice if you're unsure about drinking while on amlodipine. 5. Don't ignore serious side effects or worsening symptoms. Amlodipine is generally safe, but serious side effects require immediate attention. Ignoring them could be life-threatening. Watch for worsening chest pain or new-onset chest discomfort, which could signal unstable angina or a heart attack. Even though amlodipine helps prevent these, breakthrough symptoms need urgent evaluation. Rapid weight gain, 2 to 3 pounds overnight or 5 pounds in a week, which may indicate fluid retention from worsening heart failure. Early intervention with diuretics can prevent complications. Severe allergic reactions, like swelling of the face, lips, tongue, or throat, angioedema, which can block airways and require emergency care with epinephrine. Liver toxicity, though rare, may present as upper abdominal pain, jaundice, dark urine, or pale stools. Stop amlodipine and seek medical help immediately to prevent liver failure. Don't brush off these symptoms, report them to your doctor right away to stay safe. 6. Don't conceal pre-existing medical conditions. Honesty is the best policy when it comes to your health. Disclosing your full medical history is critical for safe amlodipine use. Conditions like severe aortic stenosis are a contraindication, as amlodipine's vasodilating effects can dangerously reduce cardiac output. Other conditions to report include heart issues like heart failure, recent heart attack, or arrhythmias. Liver or kidney dysfunction, which can increase side effect risks. Pregnancy or breastfeeding, as amlodipine's safety is uncertain, and it passes into breast milk. Allergies to amlodipine or related drugs. Conditions like lupus, scleroderma, dehydration, or diabetes, especially if on aliskiren. Full disclosure allows your doctor to tailor your treatment and avoid complications. Don't hold back, your safety depends on it. 7. Avoid dehydration. Dehydration can amplify amlodipine's blood pressure lowering effects, making you more prone to orthostatic hypotension, dizziness when standing. Amlodipine relaxes blood vessels, and dehydration reduces blood volume, creating a perfect storm for low blood pressure. This is especially risky in hot weather, where widened blood vessels and low blood volume increase hypotension risks, particularly in older adults with reduced thirst or kidney function. Exercise, which boosts blood flow and lowers blood pressure. Combined with amlodipine, this can lead to fainting or syncope. Stay hydrated, especially during heat or physical activity, and monitor for symptoms like dizziness or lightheadedness. If they occur, rest, hydrate, and consult your doctor. 8. Don't stop amlodipine suddenly. Stopping amlodipine abruptly can trigger rebound hypertension, where blood vessels overcompensate and constrict excessively, causing a dangerous spike in blood pressure. This happens because long-term use leads to calcium channel upregulation, and sudden withdrawal allows a surge of calcium, causing severe vasoconstriction. To avoid this, taper off amlodipine gradually under your doctor's guidance, typically reducing the dose by 25 to 50% every few days with close monitoring. This prevents complications like stroke or heart attack. Never stop on your own, always consult your healthcare provider. 9. Don't double doses to make up for a missed one. Missing a dose happens, but never double up to compensate. Taking extra amlodipine can cause a dangerous drop in blood pressure, leading to dizziness, fainting, or falls, especially when standing. Amlodipine's long half-life, 30 to 50 hours, means a missed dose won't immediately disrupt your treatment. If you remember within a few hours, take the missed dose unless it's within 4 hours of your next dose. In that case, skip it and resume your schedule. If you're unsure, contact your doctor or pharmacist for guidance. 10. Avoid potassium salt substitutes without medical advice. Potassium-containing salt substitutes, for example, no salt, salt sense, can be risky, especially if you're also taking ACE inhibitors or ARBs. These medications raise potassium levels, and adding substitutes, 600 to 700 mg potassium per 1/4 of a teaspoon, can lead to hyperkalemia, high potassium above 5.5 mEq/L, causing serious heart rhythm issues like ventricular tachycardia or cardiac arrest. This is particularly dangerous for those with kidney disease. Symptoms like fatigue or muscle cramps can be subtle, so regular blood potassium monitoring is essential. Consult your doctor before using these substitutes to stay safe. 11. Don't deviate from your prescribed dosage. Taking amlodipine exactly as prescribed is crucial. Your doctor tailors your dose based on your kidney function, blood pressure, and overall health. Taking too little risks uncontrolled hypertension, increasing chances of heart attack, stroke, or kidney damage. Taking too much can cause severe hypotension, leading to dizziness, fainting, or even cardiogenic shock. Amlodipine's long half-life means consistency is key to maintaining steady blood pressure. Never adjust your dose without medical guidance, stick to the plan. 12. Always inform your medical team before surgery. If you're scheduled for surgery or even dental work, tell your medical team you're on amlodipine. Its vasodilating effects can interact with anesthesia, potentially causing dangerously low blood pressure during procedures. Your anesthesiologist may adjust or pause your dose, depending on your heart health and the procedure. For dental work, local anesthetics with epinephrine can slightly lower blood pressure, increasing risks for those taking amlodipine for angina. Sharing this information ensures your team can make safe, informed decisions. There you have it, 12 critical things to avoid while taking amlodipine to keep your treatment effective and safe. By steering clear of these pitfalls, you're taking a huge step toward better health and peace of mind. Knowledge is power, and we hope this guide empowers you to manage your amlodipine therapy with confidence. If you found this helpful, give us a like, share this video with someone who needs it, and subscribe for more health tips to keep you thriving. Have questions or experiences to share? Drop them in the comments below, we'd love to hear from you. Stay safe, stay informed, and we'll see you in the next video.